Megan, I wanted to talk to you a little bit about smoking because it's a challenge, and for some families, other family members smoke, and so I wanted to first of all just reiterate why it's so important to keep a smoke-free environment, and then we can talk about what's going on for you. A baby like Molly, who's been preterm, already probably has some lung problems. Has she had some stuff going on with her lungs?
Yeah, they said that she has chronic lung disease because her lungs were underdeveloped, and when she was intubated there was some issues. She had some scar tissue and things like that, so they said it's very common.
Lungs as a baby develop late in pregnancy, and so if you're born early, your lung development occurs in the NICU instead of in mom, and so your lungs may not be functioning at quite as high a level. And so we see preterm babies with some susceptibility there. And so preterm babies who have someone smoking in the house and are exposed to secondhand smoke are at greater risk for having bronchitis, pneumonia, and asthma. And actually, really sadly, babies in that situation are at increased risk for SIDS, which is sudden infant death. And I hate to bring up such an upsetting issue, but I think the point is to realize that smoking is not just like, oh, everybody should quit smoking, but it really poses a tremendous health challenge for a preterm baby such as Molly. Do you or your partner smoke?
No, there's nobody smokes in my house.
Okay.
It has been a little bit of a challenge. Both of my parents are smokers.
Okay, so that's an important issue, right?
Yeah, they live very close by.
Right.
Molly will actually be staying with my mother when I go back to work. So.
Great.
It's been a challenge. You know, you don't want to hurt people's feelings, but Molly's health has to come first.
Exactly.
And the nurses in the NICU were very adamant about explaining the health risks of smoking before we left the NICU.
Right.
And I've been very adamant about reiterating it at home, when we're at restaurants. If I see people smoking on the sidewalk, I usually go the other way with Molly. You know, it's just, I've really, really been trying to keep her away from it as much as possible.
You've really made the priority keeping a smoke-free environment for Molly, and that's terrific. That's exactly what we'd recommend. And so, you know, if you needed help quitting smoking, which you don't, but if you needed help quitting smoking, you should definitely ask your provider for help, because there are programs you can be referred to. And for your mother in particular, she could talk to her doctor and see if she could get referred to a program as well, because keeping the home smoke-free is really, really important. Some other things to think about are drug and alcohol use, because sometimes we get real vigilant when we're pregnant, but then after the baby's born, it's easy to kind of go back. Where are you with that?
I haven't been drinking at all.
Good.
I'm a little nervous to do so, and I've never done drugs, so.
Well, absolutely. What you're doing is perfect. You want to have a safe environment for your newborn and for your child. Alcohol use can include beer, wine coolers, and straight liquor. And sometimes people don't quite realize that, so we like to emphasize to think about any type of alcohol use. And drugs can include street drugs or recreational drugs, but also over-the-counter medicines or herbal remedies. What we want to suggest to women is that basically if you are drinking alcohol or using drugs, not only does that get to the baby through your bloodstream, but also it interferes with your ability to take care of your baby in the home. And so like yourself, you're caring for a newborn and thinking about a pregnancy in the future, it really makes sense to completely eliminate any drug or alcohol use. For women that have trouble with that, they can ask their provider for help to try to quit drinking or using drugs. And so that's something to keep in your mind. So keep up the good work, and then especially as you head into the next pregnancy, no smoking, no drug or alcohol use, really important and really terrific that you're doing all the right stuff.